Hi, my name is Dr. Iqbal Said. Today I'm going to talk about key facts about diabetes and the major complication of diabetes. According to the WHO, the number of people with diabetes increased 4 times in 30 years. Diabetes is now labeled among first 10 leading cause of death with the estimation of 1.5 million deaths directly caused by the diabetes in 2019. The major cause of diabetic death is due to the diabetic complication. Diabetic complications can be divided into acute and chronic. Acute complications are usually due to either very high glucose level in the blood or very low glucose level in the blood. Long-term complications of diabetes can be divided into the microvascular or macrovascular complications. Macrovascular complications are mainly due to the blockage of large blood vessels due to the atherosclerotic clot, either in the heart or in the brain. Microvascular complications when the small blood vessels in the eye, kidney, and the nerves and are the major cause of blindness, kidney failure, and different painful numbness and muscular weakness respectively. I'm going to briefly discuss about the microvascular complication. The common mechanism by which these complication occurs is the result of high glucose level in the blood for longer period of time, leading to the production of toxic metabolites from breakdown of glucose at local tissue level, leads to the biochemical and structural damage to body cell and damage body blood vessels. Common risk factor for all microvascular complications are high blood glucose, uncontrolled hypertension, increased lipid, obesity, smoking, alcohol, age more than 40. Let's start with the eye, medically known as diabetic retinopathy. At the moment, there are globally about 22% of the diabetic patients have diabetic retinopathy. Africa is on the top with 36%, followed by North America with 33%. Predictions are there will be addition of additional 16 million new cases in the next 25 years. Now I'm going to explain the next most common, very important microvascular complication of diabetes, that is damage to the kidney. The kidney perform many useful functions to our body. A part of removing toxin and waste product, kidney control water and electrolytes. Kidney produce an hormone erythropoietin deficiency which can lead to the anemia, and kidney activate vitamin D necessary for the calcium metabolism in our body. Diabetic kidney disease is usually explained by the presence of protein in the urine or by the decrease in the kidney filtration rate, or both. These biomarkers are very useful in detection, staging, and monitoring the kidney disease. Normally, around 150 milligram per day protein excreted in the urine. With the kidney disease, it increases. We calculate the protein in reference to the creatinine, a substance which is not formed or reabsorbed by the kidney as a denominator, and we calculate a ratio, albumin creatinine ratio, and we estimate and we stage kidney disease according to the albumin creatinine ratio. Some of the condition can give false positive high albumin creatinine ratio, like vigorous physical exercise, urinary tract infection, congestive heart failure, high protein diet, dehydration, or very high blood pressure. The other kidney marker is filtration rate, medically known as estimated glomerular filtration rate, abbreviated as GFR. GFR is a measurement of how well your kidney filters your blood from waste products. The diabetic kidney disease is staged by using eGFR from grade 1 to grade 5. Stage 1 being eGFR more than 90 ml per minute, and stage 5 when the eGFR is less than 15 ml per minute, and this is labeled as kidney failure. Decrease in the eGFR and increase in the protein in the urine are the independent risk factor for overall death caused by the microvascular complications through the kidney damage. Consequences of having of kidney disease is obviously waste product cannot drain out, which can lead to fatigue, low energy, loss of appetite, early morning vomiting, nausea, muscle weakness, and swelling of feet. Other complication is anemia because of the erythropoietin deficiency, and low calcium level in the blood because there is low vitamin D. Now I'm going to discuss briefly the most common presentation in diabetes, that is burning sensation in the feet and numbness, called as diabetic neuropathy. Diabetic neuropathy has many different presentations and most common of them is sensory loss in hands and the feet. Good to remember is there are many other diseases which can give you numbness and weakness in different part of the body, such as vitamin B deficiency, hypothyroidism, renal disease, malignancies, neurotoxin medication, alcohol. We divide diabetic neuropathy in 4 different types: distal peripheral neuropathy, autonomic neuropathy, proximal neuropathy, or mononeuropathies, which only affect a single nerve. Diagnosis of diabetic neuropathy. In clinical setting, we use questionnaires such as lead assessment of neuropathic pain and symptom, Toronto clinical score system. We use Ipswich test. We use 10-gram filament assessment test. We use tuning fork test, and we use pseudoscan. The gold standard test for the assessment of diabetic neuropathy is nerve condition study. There are some pictures which can show you how we perform diabetic neuropathy check in our clinics through different instruments. Treatment of all diabetic neuropathies. The structured education program will, with a motivational interview and cognitive-based therapy for the lifestyle modification, is a must for diabetic patient. Diabetic microvascular complications are controlled by multidisciplinary team consist of podiatrist, psychologist, diabetic educator, nurse, and specialist. All of these microvascular complications can be prevented or delayed by reducing the risk factors and controlling the blood glucose level. Controlling the risk factor with lifestyle modification, dietary changes, increased level of physical exercise, smoking cessation, weight management, and effective control of blood pressure and the lipids and the glucose. And most importantly, proper screening of all of these complications on recommended times. Evidence shows that decline of all of these complications in Western countries like UK, USA, or Australia due to the increased public awareness through education of general public about effort to reduce risk factor regarding early screening of the microvascular complication and prevention. Nowadays, medicine is very common. Many mobile apps are available to track down weight loss, diet, sleep, physical activity, helping the individual to set goals. They are very useful to reduce microvascular complication. The bottom line is prevention is better than care. Thank you.